Hello, my name is Dr. Carlo Carandang, and I'm a psychiatrist. Today, I will talk about the negative cycle of panic disorder. Here, we have an example of the negative cycle of panic disorder. We start off here with the triggers, which include the physical sensation of anxiety response, increased heart rate, palpitations, and chest pains. So this situation associated with chest pains induces thoughts about what's happening. So you start thinking, I'm having a heart attack. So these thoughts in turn induce anxiety and terror, and you also have the physical sensations of the adrenaline response, in which you have increased breathing, shortness of breath, sweating, muscle tenseness. So these anxiety symptoms and the physical symptoms of anxiety are induced by your thoughts that you may be having a heart attack. In turn, these anxiety symptoms are quite uncomfortable, so the anxiety makes you avoid. So what you do then for the future is that you try to escape the situation and you avoid any possible triggers that may be inducing your panic attack. However, the avoidance maintains the belief that you are having a panic attack, and this continues the negative cycle of panic disorder the next time you have palpitations, chest pains, increased heart rate. So let's go through each one of the items of the negative cycle of panic disorder. So your trigger for panic disorder is that maybe your heart rate increases or you have chest pains. So this situation induces thoughts about the event. So your thoughts about this is that, quote, I'm having a heart attack. So these thoughts then induce anxiety. Then you get these feelings from the thoughts, which includes anxiety, terror, and the physical effects of the adrenaline response, also known as the fight or flight response. The anxiety symptoms are so uncomfortable that the anxiety makes you want to avoid any possible triggers. So you behave in such a way in which you avoid situations that may trigger a panic attack, and you avoid triggers which may trigger a panic attack. So although the avoidant behaviors decrease your anxiety over the short term, the behaviors actually maintain your overall anxiety from the feared stimulus. So the avoidance then maintains the belief that you are having a heart attack. This then continues the vicious negative cycle in which your feared stimulus induces thoughts, which induces anxiety, which compels you to avoid. So instead of just exposing yourself to the trigger and finding out nothing bad will occur, you avoid the trigger, and this maintains your belief that you are having a heart attack. So with avoidance, you never get to find out that the anxiety will go away naturally if you just stay with your trigger. So the solution then for addressing your panic attacks and your panic disorder is cognitive behavioral therapy, otherwise known as CBT. CBT helps to break the negative cycle of panic disorder by changing how you think and what you do. It is difficult to change the way you feel, so the focus is on changing the way you think and the way you do things. For more information and help on panic disorder and other anxiety problems, please visit AnxietyBoss.com. Thank you for listening. I'm Dr. Carlo Carandang.